So in our fourth section, now we will talk about delayed puberty. We already talked about puberty, precocious puberty, which is the early onset of puberty. And now we will talk about the delayed puberty. In this section, we will talk about the definition and causes of delayed puberty, how we can diagnose, investigate delayed puberty, and what's the treatment of delayed puberty. Delayed puberty is said to be puberty. We define delayed puberty when the breast tissue or pubic hair have not appeared by 13 to 14 years or menarche appear as late as 16 years. So delayed puberty, if no breast tissue develop or no hair, pubic and axillary hairs are growth occur until 13 to 14 years of age, and if the menstruation doesn't start by 16 year of age, it is labeled as delayed puberty. In this, the delayed puberty is due to gonadotropin hormone releasing, say, is IGSF-10 deficiency in fetus leads to delayed puberty. So this is in this diagram you see fetus and there is decreased production of IGSF, immunoglobulin superfamily 10, and this decreased production leads to delayed puberty. Causes of delayed puberty, it can be hypergonadotropic hypogonadism. Hypergonadotropic hypogonadism, which is due to gonadal dysgenesis, pure gonadal dysgenesis, ovarian failure, or it can be hypogonadotropic hypogonadism, in which one is hypergonadotropic, one is hypogonadotropic hypogonadism. And this is due to constitutional delay, chronic illness or malnutrition, primary hypothyroidism, isolated gonadotropin deficiency, intracranial lesions, tumors, and in which we have craniopharyngiomas, pituitary adenomas, and then eugonadism. Eugonadism means it's the normal level of gonadism. So one is hyper, excessive, one is low, and one is eugonadism or normal gonadism, in which we have anatomical causes, which is Mullerian agenesis and imperforate hymen and transverse vaginal septum. So eugonadism is mainly due to anatomical reasons like imperforate hymen and vaginal septum. So these are the causes of delayed puberty. We have hypergonadotrophic hypogonadism, hypogonadotrophic hypogonadism, and then eugonadism, in which there is also androgen insensitivity. Next, the diagnosis of delayed puberty is no breast enlargement more than 13 years of age. Exclude family history of delayed puberty and systemic illness. So if there is a girl with delayed puberty, it's important to rule out any family history of delayed puberty or rule out any systemic illness that's causing delayed puberty. Then do pelvic ultrasound. On the pelvic ultrasound, if there are ovarian changes present, it means it's just maturation delay. More likely is a patient is short for family. So if ovarian changes are present, it's maturation delay. But on pelvic ultrasound, if prepubertal or small ovaries are present, do the test for LH, FSH. If FSH, LH level is raised, it means person has ovarian failure. If levels are low, go for gonadotropin releasing hormone test. Absent response, it means gonadotropin deficiency or hypothalamic disturbance, tumor, eating disorder, prolactinemia. So diagnosis is depending on history. Then do pelvic ultrasound. On the pelvic ultrasound, if normal ovarian changes, it means just the normal developmental delay. If ovaries are small ovaries, then go for test for luteinizing and follicle stimulating hormone. If the levels are raised, it's ovarian failure. If its levels are low, it means there is gonadotropin hormone effect. Go for the test for that. If it's absent response, it means the gonadotropin hormone deficiency or there is some problem in the hypothalamic disturbance, which can be tumor, prolactinemia, or eating disorder. Then the investigations of delayed puberty, we have hypogonadotrophic hypogonadism and hypergonadotrophic hypogonadism. In hypogonadotrophic, we have healthy short back relative to legs. Usually it means constitutional delay in growth and puberty. If there is chronic disease, poor nutritional status, it means the patient has inflammatory, autoimmune conditions, malnutrition, anorexia, or patient is athlete. Go for specific investigation. If patient has short stature with decreased height, it means CNS disorder, tumor, or pituitary failure. Go for thyroid function, insulin growth factor 1, prolactin, pituitary, MRI scan. These all tests should be performed. Then if there are dysmorphic features, go for karyotype. It usually have disorders like Klinefelter syndrome, Turner syndrome, Prader-Willi, Kalman syndrome. So all these are the disorders associated with dysmorphic features. And then pelvic ultrasound should be performed. Patients who have hypergonadotrophic hypogonadism, we have low estrogen or testosterone, primary gonadal failure, defects of testosterone synthesis. If there are high testosterone level, usually biosynthetic defects of steroid synthesis, for example, aromatase deficiency. Then we should go for molecular studies, steroid hormone analysis. So these are the different investigations done depending on the appearance of the patient and the features of the patient. Treatment is according to the cause etiology. Treatment is non-endocrinal, which is assurance to the patient, improvement of general health of the patient, and treatment of any illness that is present. Hypogonadism is cyclic estrogen are given. Unopposed estrogen is given for first 6 months. So cyclic estrogen unopposed without any progesterone for the first 6 months. After that, the combined estrogen and progesterone are given. Then hypergonadotrophic hypogonadism patients are treated by chromosomal study to exclude any intersexuality or to rule out any chromosomal disorders. So that was all about the delayed puberty. Thank you for watching sqadia.com.